Hi, everyone, and welcome to another episode of One Health Talks. Today, we're exploring interdisciplinarity, and we have with us Irfan, who is someone with a beautiful discipline that not many people know about. And it would be lovely for him to kickstart. We will kickstart the series with him, and he'll be able to explore his discipline and how it links to One Health and global health. Hi, Irfan. Nice to meet you.
Hi, Julian. Thank you so much. So it's a privilege actually talking here and letting people know about my discipline from where I come. It's really a privilege. So basically, it's a discipline called psycho-oncology. So as you see, the word psycho and oncology, it's an integration of two fields together. So for example, in my case, I finished my master's in applied psychology. And then I did my specialization in psycho-oncology. So the specialization which I did was based on the emotional and quality of life aspects of cancer and how they transcend from like the stage of prevention till end of life and even after end of life. So I'm the one who takes care of the emotional and psychological aspects of cancer along with their behavioral and quality of life implementation. So it's not only about taking care of patients, but it's also about taking care of their family, their caregivers, their physicians who are actually treating them, the nurses who are in this whole scenario, and a lot of other disciplines who come into play. So it focuses on like two main things, for example. And the first thing is that how the diagnosis of cancer changes the psychological and emotional trajectory of a patient while he or she is undergoing through the stages of and the treatments of cancer, for example. And also the second one is that how psychological and behavioral aspects of an individual lead to a perception of viewing cancer as a whole. Like,
that's interesting.
So it's like a two-way. So one was actually how cancer impacts the person's psychological and emotional well-being. The second is how psychological aspects put a person, for example, on a risk of getting certain cancers, for example. So the first one, I'm sure that all of you would have understood that obviously if somebody gets a diagnosis of cancer, it's really like an emotional turmoil for anybody who gets cancer. So that's understood, that we all know. But what's interesting here is the fact that how your behavioral and psychological makeup can influence, you in a particular way. Exactly. So it's, for example, when we talk about self-awareness, screening, prevention, lifestyle, and all of those things, for example, it's all behavioral, like what you do, its implications would be on your health, for example. So it's very interesting to mention here that up to 40 to 50% of all cancers that we get can be prevented.
Wow.
So which is a great number. And and it's like, it's not only about the patients who, like the people who get diagnosis with cancer, it's about their families. I mean, of course, a person gets diagnosed of cancer, he is the immediate recipient of certain kind of situation. But if we look at this on a meta level, for example, it's not only that single person who's operating, it's his family, the society, the economic burden for that region, for that country. So that's what we are looking here. So your second your second question, Julian, was about how is its relevance in a global health perspective. Exactly. So I would kind of try to make a link. What I said previously is that up to 40 to 50% or even more of these cancers can be prevented. So it's it's like, I'm sure that all of you know, and I guess a lot of people from us, there would be somebody in our friends, in our relatives, who would know somebody with cancer,
Yes.
or maybe the friend of a friend, or the mother of a friend, or the cousin, or whatever.
Very
I
true.
mean, so it's so prevalent in our society. And the unfortunate thing is that from last 2 decades, it's actually increasing. We are getting more and more cancer patients
Yeah.
every year, but that does not mean that we have not reached a point where we are providing optimum care to the people. It could be associated with many reasons that we are getting more people, because it could be because now the screening and prevention is improved to a very high level. So
Level.
people like 30 years or 20 years back who would not know that it could be cancer, they're coming now to us to get screened, to get a lot of like checkups and all of that. So with that, we are actually getting a lot of cancers at very early stages. So obviously that will increase the number of cancer patients that we get every year.
Yeah.
The second part of it is that, although a lot of things have improved, but at the same time, there is a huge prevalence which is there still, and the incidence is also increasing. It could be because of the fact that uh, there could be a lot of risk factors involved. That's why we see a lot of people getting diagnosed with cancer, and a lot of people at a very young age, which was not the case before. It could be because, for example, let's say health style, lifestyle, for example, what we eat, how we think, how do we approach to our like what's our approach towards stress, like
Mhm.
everyday stress, all of this. And of course the genetic part of us, which is always there, and which is the base for everything.
Exactly.
So that's how we are getting all of these things. It's like an interplay and interaction of a lot of things together.
All connected. Come.
So I would say it's like, when you plant a seed in the soil, it needs soil, we need a seed, it needs warmth and sunlight.
Yeah.
So your body is already, kind of that environment where we can get a lot of disease, for example. But it's not necessary that we will get all of those disease. Everybody will not get all of these disease. For example, in my practice, I would quickly tell you a reflection. When I used to see patients, a lot of people would say that, why did I get lung cancer? I never smoked in my life. So to it's the lung cancer is associated with smoking, but it does not mean that the person who smokes will get
Going
cancer.
to get,
It's
yes.
already a risk factor, so you
Yes.
have a risk then. But it's something underlying, it's your genetics,
Yeah.
how it will respond. But, and coming back to that global part of my specialization is that, if when we get when somebody gets cancer, and it's happening on a very huge level, for example, in countries and in regions, so we would also see we are losing a lot of for example, for economy part, for example, we are losing a lot of predictable years of an individual, where he could contribute to the society, and where he could live a healthy life and quality of life. So that's one part of it. And then how much we invest in that health system as a country or globally, for example. So a lot of our budget, for example, on a global level, is being pushed to that direction, because we have a problem, and we just want to take care of it. On the other hand, where we could actually use that sum of money or budget into developing something else, maybe in some kind of other research which is relevant, or
Yeah.
infrastructure, for example. So it's not happening on country basis, it's happening globally.
Yes.
So that's why we need a global perspective to deal with this.
With it.
So it cannot be achieved when we have a lot of psycho-oncologists. No, I mean, I am a very minute part of that game. It's everybody's
Still a
game.
very important part at the end of it all, you know?
That's very generous, but yes, I understand that. But actually, it's not only my game and your game. It's actually everybody's
Yes.
game. It's everybody is on stake. Everybody has to play, and I guess everybody is an actor, and everybody should play. We should not
Part.
wait. Actually, okay, these people, they should come and they should actually find it. No, it's the responsibility of all of us as a discipline, as individuals, and as people on the globe.
Yeah.
We have to actually do our best. We can do it from a very small level. For example, educating two people on a street about
Yeah.
screening or prevention or lifestyle, or maybe on a bigger regional level or country level, where we could actually reform our policies in healthcare and implement them according to the trends what we see in our country, for example. So that's what it's all about: integration,
All of
equity,
that together.
and collaboration. So
Yeah.
that's what I would say.
That's awesome. Thank you so much for that. But just to there was a point that you made that I thought was very interesting, because right now you are at the intersection between non-communicable diseases, the cancer aspect of it, and then psychology, which touches a lot of mental aspect. And right now, mental awareness and mental health is really on the rise,
Exactly.
And I love how your discipline has the link already between these two very important aspects in the health sector that are showing, that are really popular in that sense. I mean, trend worthy right now for everybody. So that's why I thought that it was interesting that you spoke a lot about the cancer aspect, which is right now killing a lot more people than the communicable diseases. They say that this is the silent killer that is happening right now. We have so many new cases of non-communicable diseases that are going out everywhere. And cancer is one of the big ones that a lot of resources are being pushed into. But then the aspect that you bring that I think is very interesting is how the mental health aspect of it, or how the community has to also play a role in the way they perceive the cancer treatment, the way the cancer patient is undergoing the treatment, and his perceptions and the behavioral changes that are going to occur, so someone to be able to guide them through that and to help them to understand these changes that are going to be happening, so I really feel that, yes, it's a specialization and it's there, but it also shows already that people are creating a specialty that touches different disciplines at the same time.
True.
So I think it's a big step forward already in the way that we're looking at education, and that was why I thought that it was awesome that you were able to share this with us. So thank you so much for that.
Thank you so much. It was really an honor, and I wish you all the best for what you're doing. And yeah, I hope to see you soon.
Yes, definitely. Thanks a lot.
Okay, bye.
Bye.